When mentioning middle age, many people often picture clear changes in health, body shape, and mental state. These are signs like graying hair, wrinkled skin, sometimes unexplained fatigue, or worries about work, family, and the meaning of life. But among all these changes, there is a very important aspect that we often hesitate to mention, or even forget, which is sexual health. In fact, sexuality is not just a simple instinctual need, but also an emotional bond, a source of confidence, a catalyst for happiness and quality of life. In middle age, although the body is no longer as vigorous as in the 20s, sexual life can still be passionate and fulfilling if we know how to take care of ourselves and adapt to natural changes. First of all, it is necessary to have a correct understanding of sexual health in middle age. Sexual health is not only the ability to have sexual intercourse, but also emotional satisfaction, a deep connection with one's partner, and a feeling of comfort and confidence with one's own body. The World Health Organization, WHO, defines sexual health as a harmonious combination of physical, emotional, intellectual, and social aspects related to sexuality. That is, it not only depends on hormones or physiological ability, but is also closely related to psychology, lifestyle, and the way of communication and mutual understanding between the couple. In middle age, usually from 40 to 60 years old, each person's body undergoes significant changes. Hormones change. The circulatory system and nervous system also undergo certain adjustments over time. These effects can influence desire, responsiveness, and emotions in sexual relationships. However, more importantly, sexual health at this stage is greatly affected by one's attitude towards life, attention to overall health, and open communication and sharing between the two partners. Physiologically, both men and women experience very characteristic changes when entering middle age. In men, testosterone levels begin to gradually decrease after the age of 40, averaging about 1 to 2% per year. This is the reason why many men feel a reduced libido, have difficulty maintaining an erection, or notice that their muscles are no longer as firm as before. The recovery time after each sexual encounter also becomes longer. Additionally, circulatory problems such as cardiovascular disease, diabetes, and high blood pressure can directly affect erectile function. In women, the perimenopausal and menopausal processes bring many hormonal changes, especially a decrease in estrogen and progesterone. This can lead to vaginal dryness, reduced elasticity, hot flashes, insomnia, and sometimes uncomfortable hot flushes. Sexual desire also decreases, not only due to hormonal changes, but also because of psychological effects. Feelings of anxiety, low self-esteem about appearance, and pressures from work and family. All of these factors can affect interest and confidence in married life. Overall, there are many factors simultaneously affecting sexual health in middle age. First is hormones, the fundamental biological factor that determines desire and sexual responsiveness. Physical health also plays an essential role. Chronic conditions such as obesity, diabetes, high blood pressure, and heart disease all negatively impact sexual life. On the other hand, psychological stress due to work pressure, responsibilities with children, financial worries, etc., can all reduce interest. The marital relationship is also a major factor. If there are conflicts and a lack of communication, the couple can easily become distant or reluctant to be intimate. Additionally, the use of certain medications such as blood pressure drugs, antidepressants, and allergy medications can also cause side effects that reduce desire. Although there are many challenges, maintaining a healthy sex life in middle age brings many benefits. First, regular sexual activity helps the body release happiness hormones such as endorphins and oxytocin, boosting the immune system and promoting mental well-being. Scientific studies have shown that moderate sexual activity also improves cardiovascular function, promotes blood circulation, and reduces the risk of heart disease. After each intimate encounter, happiness hormones are released, helping to reduce stress and anxiety, and even improve sleep quality. Most importantly, a fulfilling sex life strengthens the bond, trust, and empathy between spouses. Many studies also indicate that those who maintain regular sexual activity tend to be more youthful, more joyful, and have more vitality. However, many middle-aged people face sexual health problems and find it difficult to share or seek solutions. In men, erectile dysfunction is the most common challenge. If this condition persists, gentlemen should proactively check their cardiovascular health, blood sugar levels, and if necessary, use medication as prescribed by a doctor. Premature or delayed ejaculation is also a common issue, which can be improved through control exercises combined with psychological counseling or changes in sexual techniques. In women, vaginal dryness is a very common issue, especially during the perimenopausal and menopausal stages. To address this, water-based lubricating gels or topical estrogen can be used under medical advice. A decrease in libido can also be improved through communication with the partner, creating a romantic atmosphere, maintaining novelty, and paying attention to one's own emotions. Sometimes, pain during intercourse can occur in both men and women, which may be due to inappropriate positions, lack of lubrication, or underlying health problems. Do not hesitate to adjust, experiment, or see a specialist if necessary. In addition, emotional disconnection is a major issue for many middle-aged couples. Living together for a long time can cause both people to forget to ask about, listen to, and sincerely share their needs and desires. To overcome this gap, take the initiative to speak up, share your thoughts and feelings, and don't hesitate to talk about what you want from your partner. So how can we improve sexual health in middle age? First, pay attention to maintaining physical fitness. Cardio exercises such as brisk walking, cycling, swimming not only help improve blood circulation, but also increase the body's flexibility and endurance. Strength training with light weights or resistance exercises helps maintain muscle mass, stabilize hormones, and create a confident feeling about appearance. Healthy eating is also very important. Include foods rich in zinc, such as oysters, beef, or nuts, omega-3 from salmon and mackerel, vitamins E and B6 from green vegetables, fruits, and whole grains. Limit alcohol and tobacco, as they not only negatively affect overall health, but also reduce sexual desire. Stress management is the key to maintaining love in middle age. You can practice meditation, yoga, or participate in relaxing activities such as reading, listening to music, or taking walks with your partner. Don't forget to take time to rest and get enough sleep, as poor quality sleep will inhibit hormones and reduce vitality. A simple but effective secret is to always create freshness in your sex life. Changing the setting, such as trying a trip for two, changing the bedroom space, or experimenting with new safe experiences helps increase excitement and connection. Share your fantasies and desires with your partner respectfully. Listen to each other and explore new things together. Regular health checkups are essential. Regularly check hormones, cardiovascular health, blood pressure, and blood sugar levels. If any unusual symptoms appear, do not hesitate to consult a doctor about hormone therapy, supportive methods, or appropriate professional advice. Never consider sex in middle age as a decline or a sign of old age. See it as a phase of rediscovering yourself, a time to value quality over quantity. One emotional, deep, and understanding encounter is worth much more than many superficial, rushed ones. Always combine physical, mental, and emotional aspects to maintain sustainable sexual health. If problems persist, don't hesitate to consult a urologist, gynecologist, or psychologist for timely advice and support. Middle age is an exciting stage of life. You have gained many experiences, maturity, and a better understanding of yourself as well as your partner. Sexual health at this time is not only about maintaining desire, but also about connection, sharing, and enjoying life together. Pay attention to overall health, open communication, and always look for ways to refresh your relationship. If you take good care of your body and soul, middle age will become a period full of passion and happiness, both inside and outside the bedroom. Cherish every moment with your life partner, listen to your body, proactively take care of your health, and never stop exploring and sharing love. Fulfillment in sexuality is not a luxury, but a right. a happiness you fully deserve at any stage of life. Don't let worries, insecurities, or hesitations prevent you from fully enjoying happiness. Whether you are in your 40s, 50s, or 60s, remember that each day is a new opportunity to love, connect, and renew yourself. If there is anything still incomplete, start with an honest conversation with your life partner or a small step in healthcare, such as exercising, eating healthily, or going for regular health checkups. Be persistent, gentle, and loving to yourself. When you learn to appreciate yourself, happiness will naturally spread, and the flame of love will always burn brightly, no matter how much time passes. Middle age is not the end of passion, but the beginning of a new journey, a journey of understanding, sharing, and enjoyment. Sexual health in middle age is proof of enduring love, a fulfilling life, and a youthful, energetic spirit. Be bold to move forward, take care of yourself and your love, because you deserve a happy, radiant, and loving middle age.